My name is Dr. Charlene Emmanuel, and I'm an OB-GYN at New York Presbyterian Columbia University Irving Medical Center. In my practice, I help patients understand what's happening in their bodies as it relates to gynecological health, pregnancy, and more. Pregnancy is divided into 3 trimesters, which last between 12 and 14 weeks. The first trimester is truly an exciting time with plenty of new changes. So here's a quick breakdown on what happens week to week as you begin this new stage of pregnancy. Weeks 1 and 2. The clock ticks on the first day of your last period. Technically, there's no pregnancy yet. Conception occurs about 2 weeks from this day, and that's when pregnancy truly begins. The due date will be calculated from the first day of your last menstrual period. If you're trying to conceive, please start taking prenatal vitamins. Quit any unhealthy habits such as smoking and consuming alcohol. Now's the time to have a conversation with your doctor about what medications are safe to continue taking during pregnancy. Do not stop any prescribed medications without talking to your doctor first. Week 3. Conception occurs this week, and the egg and the sperm meet in the fallopian tube. Most likely, it's too early to experience any pregnancy symptoms at this time. After fertilization, the ovary starts ramping up the production of progesterone, a hormone that prepares the uterus to host a newly fertilized egg, or zygote, that will live there for the next 38 weeks or so. About 4 days after the egg is fertilized, it begins producing a hormone called human chorionic gonadotropin, or HCG, which pregnancy tests can detect in about another week. First in the blood via tests at your doctor's office, and then in urine, which an at-home screening would spot. There's nothing to see quite yet, so hold tight. Week 4. The pregnancy implants in the uterus. Some spotting may occur at this time. You may start to feel symptoms like bloating, cramping, fatigue, frequent urination, nausea, or moodiness. If you do not have these symptoms, that's completely normal, and lucky for you. Week 5. Although the embryo is only the size of a tiny grain of sand, the heart is pumping blood, organs start to develop, and arm and leg buds start to appear. Week 6. Now's the time that doctors typically do a first ultrasound scan to see how the embryo is doing and to estimate a due date. Week 7. The embryo will double in size and still be very small. As the pregnancy progresses, hormones will increase and may cause more obvious symptoms associated with the first trimester, like morning sickness. Week 8. It's time to check the embryo's heartbeat again with an ultrasound. You'll receive the official due date, though many people do not deliver on the exact day. It will give everyone involved an estimate to prepare for the new arrival. Week 9. The pregnant person might feel more pressure on their bladder as the uterus grows, causing it to leak small amounts of urine. While this can be normal, a solution can be found in doing Kegel exercises to strengthen the pelvic muscles. Week 10. The embryo is now a fetus. If you are over 35, your doctor may want to perform tests to further monitor the health of your fetus, such as blood tests called non-invasive prenatal testing, or NIPT. Depending on your risk factors, doctors may recommend more invasive testing called chorionic villi sampling, or CVS, which screens for genetic problems. Week 11. Cravings will start to range from everything from fatty, greasy foods to non-food items like soap. If it happens, it could be a symptom of a condition known as pica, which can signal a diet deficiency. Now's the time for nuchal translucency tests to screen for Down syndrome and other genetic conditions. By this time, the fetus should have nearly all of its organs start to function and genitals begin to form. Week 12. This stage of pregnancy is when the belly starts to show. This is due to the uterus expanding beyond the pelvic bone. Doctors will advise pregnant people to start avoiding exercises that pose risks to trauma to the stomach area or require laying flat, which can put pressure on the major vein that reduces blood flow to the uterus. Also, avoid spinal twists and inversions when doing exercises such as yoga. Week 13. As you start to feel better, realize that there is no need to eat for 2. Only 300 additional calories are required above a normal dietary intake. Your first trimester of pregnancy is over. Make sure that you hydrate, keep calm, and always check in with your doctor if you're experiencing any major discomfort or symptoms. Take care.